Hello everyone. I hope that you all are doing fine. I thought that maybe I should do this crack tooth topic with all of you because it is very important topics, and at least you will get one or two scenario from only this article or from this topic. Okay, and even in the daily life as well, we do see like these patients very commonly, and these days cracked tooth is very common because most of the people are stressed, mainly after the COVID situation. So most of them are stressed and they do bruxism or clenching that is leading to cracked tooth. And yeah, so we will read about it and we will get more knowledge. And along with this topic, I do recommend reading Cracked case from the Ordell, that is case number 11. Okay. All right. So with this topic, we will start from here. The term longitudinal, maybe we should start from here. This newsletter is intended to help resolve some of the confusion surrounding tooth cracks and fractures from a specialist perspective. The goal is to help general practitioner with the diagnosis and treatment planning and to foster clearer communication between members of the dental team. Like the crack is always very confusing topic for everyone, right? Because we cannot diagnose the crack even on x-ray, so it is just a finding that we need to find out. Either we can see the crack clinically or we need to find out by taking history or by doing other investigations. This review investigates diagnostic and treatment challenges related to tooth fractures, primarily in the long axis of the crown or root. This includes how to determine the extent of longitudinal fracture, when a coronal restoration should be placed, when a root canal treatment is needed, and when a tooth or root should be extracted. So, in this article, we will be reading in detail the types of the cracks and how we can diagnose them and how we can manage them, either by putting a restoration, or we need to do a root canal treatment, or we need to take a tooth out. So this article will help us in making a decision. The term longitudinal fracture is used because it typically represents vertical extension of fractures over distance and time. These linear fractures tend to grow and change as opposed to those resulting from impact trauma. Thus, there are often problems with diagnosis and treatment. Cracks in teeth are findings that are to be detected in terms of location and extent. Okay, so cracked tooth is not a diagnosis. Even if you get a scenario in which you think that there is a crack in the patient's tooth, so when they ask you what is the diagnosis, so diagnosis would be either reversible pulpitis or the irreversible pulpitis. I just want to show you, like, for example, here, right? So this is the tooth, and there is a crack here, and this is the pulp. Okay, so if because there is a crack, so there is a pathway for the oral bacteria to travel inside the tooth. Okay, so if the symptoms that patient is presenting to you is just like reversible, like there is sensitivity, and but it is going away with the stimulus and it is not long lasting, the pain is not throbbing or lacinating, and it is just triggered by the stimulus, it just lasts for few seconds, so then you can do other investigations and do the management as a reversible. So that diagnosis would be reversible pulpitis, not the cracked tooth. But in case if the crack is deep and it is extending towards the pulp, okay, and the bacteria are continuously going towards the pulp and they have irritated the pulp, so now the symptoms would be for irreversible pulpitis. That would be that could be pain on biting, or the pain that is disturbing sleep. Okay, so you need to find out the diagnosis. The cracked tooth is only the finding. And second thing which is very important that they have given here is the that the teeth findings are in terms of location and extent. Okay, so you need to find out. So I'll just clear all these. Okay. So, for the crack in teeth are findings that need to be detected in terms. You need to find out what is the location of crack and what is the extent. So that would, because that is the main thing that would decide in management. If the crack location is only in enamel, like crazed lines, then and there is no symptoms, then you do not need to do any treatment. But if the crack is going towards the pulp, okay, and extent means that it is extending towards the pulp or it has extended through the floor of the pulp. So the management would be different, right? So that is the very important points that we need to determine what is the location and extent that would help in management. Crack detection is one aspect of a thorough diagnostic evaluation, but the presence of a crack alone does not provide information on the status of the pulp or periapical tissue. So, even if there is a crack in any of the tooth, it does not indicate like what is the condition of the pulp, right? So, we need to do certain other investigations as well. Other diagnostic tests must be performed to determine a diagnosis. Practitioners must be aware that the major problem with having a crack in a tooth is the potential for bacterial penetration, because that is a pathway and bacteria are going inside and irritating the pulp and the inner layers. Therefore, crack present in the teeth are findings only. They are not to be considered a pulpal or periapical diagnosis. With these considerations, many teeth with cracks can be saved. Okay, the key to saving these teeth are to know how to identify and classify the cracks, because there are 5 types of cracks. So you need to identify them and classify them, like which type of crack is in your patient's tooth. Then you need to know what are the characteristic signs and symptoms and how to detect the crack as early in its development as possible, because that would be a good prognosis if we will find it at earlier stage. Then defining crack types, the location, the direction and the extent. So they have divided into 5 parts based on the location, direction and extent of a crack have a more profound effect on the choice of treatment. So clarity is important. For consistency in this newsletter, the 5 types of longitudinal tooth fractures are described as follows. First is crazed line. Second is fractured cusp, cracked tooth, split tooth, vertical root fracture. Just try to remember that the prognosis would, here the prognosis is good, then it is going towards worst. Okay, and we will discuss in detail in the following pages. Then lack of knowledge concerning the type, characterization and variety of fracture may lead to misunderstanding with incorrect diagnosis and inappropriate treatment. If you do not have knowledge, then you won't be able to make a good diagnosis and good treatment. These five categories of longitudinal fractures have been devised to provide global definitions that researchers and clinicians can use to decrease this confusion. Only after these fractures have been defined and characterized can there be a better understanding of their epidemiology. This review will show how each longitudinal fracture classification is different, especially related to prognosis and treatment modality. Okay, so we will start from the first one, that is the craze line. So craze line only affects the enamel. Okay, while the fractured cusp, cracked teeth, and split teeth begin on the occlusal surface and extend apically, affecting enamel, dentine, and possibly the pulp. Vertical root fracture begins in the root. Alright, so I'll just explain you here. So, for example, these are the 3 layers of tooth. Okay, so craze line only affect the enamel, but The other ones, which are the fractured cusp, cracked teeth, and the split teeth, they can involve all these three lines. But all of these four, they starts from the occlusal surface. But the vertical root fracture, it begins from the root part and goes up. Okay, so these are the 5 classifications. Then all types except crazed lines are found most often in posterior teeth. Okay, so crazed line would be found in the upper anterior teeth. Other than that, all others will be found in the posterior teeth. Unlike a broken bone, the fracture in a cracked tooth will never heal. So even if we have any broken bone,